We're the people that people call when they don't know what else to do. Nowadays, we respond to fires, motor vehicle accidents, hazardous materials incidents, emergency medical situations, fire prevention incidents, following up with public assistance, whether that be through complaints or issues with buildings, wires down, storm coverage. It's so much of it. So our day is never normal. There's never a normal day. We are the same manning at 6 members per shift that we were in 1970. 1970, we ran about 1,000 calls a year. We're in the area of about 4,500 calls a year and 2 ambulances now. Those 2 ambulances get used every day, and then we can go from there to a building fire. We strike what we call strike a box multiple times a day, sometimes 5, 6, 7, where we have 2 calls going on at once, or 3 or 4. We have to rely on off-duty help, mutual aid. We have mutual aid agreements, but every other community is going through the same thing. And we had a situation, I want to say 15 years ago, in which we couldn't provide mutual aid because we had cuts. We have to sign a mutual aid agreement each year for our Office of EMS state license for the ambulance. And we have to agree that we can supply it. If we can't supply mutual aid, other communities are not going to supply it back. Sometimes the hospitals are so busy that we're standing there with them for 15 minutes until they can assume care. We can't relinquish care until we hand off to somebody and they get them in a room. They can be delayed at the hospital between run reports, restocking of medications. They can be delayed sometimes 45 minutes.
Wow.
Our people work really fast to kind of turn over quick, and a lot of times you'll hear us, the ambulance on the air saying A1's clear of the hospital, and they're like, A1, please respond to, and they're just about to call. So they're nonstop busy, and that can delay things. We know our people. We're there in a minute's notice. One of the most prideful things in the department is we started the paramedic program in 1998 with 1 paramedic. Every member of our department is cross-trained as a paramedic. We're there in a moment's notice. We know our people. The income stays in with the town. We fund that general, we push it to that, and we give people the very best care there is. We have faith in our taxpayers. They've always been there for us, and it's our job to give them the best that we can possibly do. And it's our job to explain to them item by item where we are. We're an open book on anything. We'll figure out a way, but it's scary, and I'll leave it at that.